Vitamin B12 and adrenal fatigue. A lot of people feel very tired and their doctors tell them to take some vitamin B12, but is that the good thing to actually do or not? I'm Dr. Carrie Lam. This is Dr. Michael Lam.
Well, B12 has been around for decades. And in the old days and even now, it's been extensively used to boost energy. You hear of older ladies that get their weekly B12 shots from their family doctors, and nowadays people use B12 either in IV form to get over hangovers, for example. So it's a water soluble vitamin. It is part of the family that goes into the body that comes out really quickly. B vitamin family is particularly good for the neurological symptoms. So in fact, a B vitamin deficiency, you will have a lot of neurological deficits, including memory issues. But the B12 has different forms, and most people don't understand that. And not every form is good for every person. So for example, if you have a MTHFR type genetic defect, and then you want to use the methylated form of B12 rather than the regular form. So the amount of information we have now in the understanding of B12 is far, far greater than what it was before.
So and you were talking about the methyl B12 versus hydroxycobalamin. So cobalamin is B12, and there is a difference in what the cobalamin is attached to, whether it's a methylated one or a hydroxyl related to the B12.
Yeah, in the case of adrenal fatigue, one has to be very careful because the body in an adrenal fatigue system tend to be already kind of excitatory, irritable, especially if a person is on glandulars like rhodiola, green tea, maca, and things like this. So throwing in B12, a lot of people, I see they are on it already because their practitioners put them on it in order to generate energy. But after a while, their body get used to it and they need more, and they become wired and tired. So if you use B12, you have to understand that the B12 has an intrinsic stimulatory property, and it's not something you want to do all the time. It has its place. We use it when we are dealing with the neuroendometabolic stress therapy, but we also pay attention to the overall picture to see whether this is actually what you need. And on top of that, you have to pay attention to the dosage because, the RDA, for example, for B12 is rather low. But nowadays, if you go outside and try to buy a B12 supplement, it's, minimum from 500 microgram to 1,000 microgram. If you do an IV, it can be in 5,000 to, or more B12. And most people feel a little bit better. And this is one of the biggest dangers because if you feel better, you tend to think that this is exactly what your body needs. But a body that is strong, and when you give B12, they actually don't have a reaction. It's only the weak bodies that has the reaction.
They kind of just urinate it out.
Yeah. So, and of course, the color also changes with vitamin B as a family, you see. But it's far more complex than what most people think. I think that's the take-home lesson. If you're not sure, don't just try to proceed, especially if you have adrenal fatigue. Find someone who really knows what they're talking about to guide you because you don't want to crash your system.
Right. There are real deficiencies in B12, like if you have a gut problem, you don't have intrinsic factor, you have gastritis. And so those are real diseases where you might need vitamin B12 and you need to follow your doctor in giving you B12. Or if you have a folate deficiency or any type of like anemia, where you might be low in B12, or if you're vegan, those are all important things that might make you lower in B12, and you should definitely follow your doctor. But if you are just some normal person with like an adrenal fatigue and you don't have any of those issues, you have to be very careful in taking this vitamin B12 without knowing where you're standing and how stimulated you could be from it. And so that is our vitamin B12 talk if you have adrenal fatigue syndrome. And we are here to empower you to take control of your health. We hope you enjoyed this video.